Hi, I'm Adam Olivero, and we're here in Durham this morning because we're going to hear a little bit more on updates from the Ontario Health Coalition about things that are happening in our local hospitals. And before I get too far into the details, I'm going to turn things over to Kevin from CUPE, and the presentations is we'll learn more today about what you can do to help your local hospital.
Good morning, everyone. My name is Kevin Cook. I'm the first Vice President of the Ontario Council of Hospital Unions within CUPE. We are working hand in hand with the Health Coalition to send this message across the province. And I am so glad to see you all come out with such enthusiasm to defend our public health care system and defend this government's privatization policy. This giant wooden horse behind me is the Trojan horse. It's the perfect metaphor for this government's privatization policy. The Trojan horse is a story of the Greek mythology that the Greeks presented this giant horse to the city of Troy as a gift to signal the end of war. In the horse were soldiers, and when the city slept, they destroyed the city. The Conservatives have presented the privatization as a gift. They say that private clinics will reduce wait times, that they will alleviate the crisis in our hospitals, and then that provide the care that the people need. Nothing could be further from the truth. Their plan is deceptive, and it is dangerous for our public hospitals. Last year, when Ford government passed legislation to expand private for-profit clinics, we loudly campaigned against it and warned the people that it would create a two-tier system, that it will benefit the wealthier people at the expense of the working class, that private clinics will prioritize profits over patient. And the Ford government gave all these false assurances at a time saying that wouldn't happen, that we could always rely on the OHIP card and not a credit card. Well, that's not true. The Ontario Health Coalition has documented mountain evidence of patients being extra billed for OHIP covered services. People have had to routinely pay out of pocket for cataract surgeries, MRIs, primary care, and diagnostic tests. Private for-profit clinics are price gouging patients for desperate for care. Patients have been threatened with longer wait times if they choose not to pay out of pocket. Patients have been manipulated or coerced into paying out of pocket for unnecessary added-on services. Patients have been charged for consultant, administration, membership, and appointment fees. There have been cases of patients being charged up to $8,000. $8,000 of these private for-profit clinics. $8,000 for services that would have been offered free of cost in our public hospitals. Who can afford to pay for these services? How many ordinary people can afford this care? How many Ontarians have $8,000 lying around to pay for cataract surgery? How many seniors on pensions can afford this? In August, there was a new study on private clinics published by the Canadian Medical Association Journal. It found that rates of surgeries in private clinics went up by 24% in private clinics for the wealthiest people in Ontario and declined by 9% for the lowest income. In other words, if you're wealthy, you jump the queue and get treated. But if you're middle class, you wait. We must send this government a strong message because we, as Ontarians, care about our public health care. We care about the principle that care should be provided based on your need, not your ability to pay. We are here today to say, why would we pay more than twice as much for surgeries in a private clinic than we could do in the public hospitals? Why would we encourage privatization of surgeries when the Canadian Medical Association Journal has found that the wealthiest Ontarians have much more access to private cataract surgeries, while waits for middle-class people have lengthened? Why would we let the private clinics pay 50% more to steal staff from public hospitals, worsening a staffing crisis in our public operating rooms? Why would we let this public be exposed to paying all sorts of extra charges and hundreds and thousands of dollars for services that are free in our public hospitals? This policy is more expensive, wasteful, and in lengthening wait lists and gouging the public. We are here to demand that the provincial government revises its policy on privatization of hospital surgeries. Now, not long ago, COVID hit us, and we've seen what privatization did across this province with long-term care. It destroyed that. and it was healthcare workers that had to go in. They sent the military in. They couldn't help. It was hospital workers that fixed these private long-term care homes. That is what's going to happen to these hospitals. We need to send a message to this Ford government. Our next speaker is Nora from the Health Coalition.
Well done, Kevin. I'm Nora Beattie, one of the co-chairs of the Grey Bruce Health Coalition, and our coalition is affiliated and we work with the Ontario Health Coalition. I'd like to give you just a little bit of a broader scope, an overview of what is happening to our hospital and our healthcare system. Kevin has very well outlined many of the problems and the extra charges and billings, etc. I want to make clear the direction of our healthcare, despite all of the lies and deception from our government. And we need to stop those lies and deceptions. 3 months before the last election, the Ontario Health Coalition warned that Ford was going, and the Conservatives were going to privatize our healthcare system, and Ford outright lied and said no, he wasn't going to do that. 3 months after the election, he announced his first privatization plans for our healthcare. At the same time, they doubled the funding to private clinics. The polls in Ontario and across Canada, in fact, show that the public wants public healthcare system, a healthy public healthcare system. And the polls prove that Ford does not have a mandate to do the privatization of our system that he is doing. On January 16th in 2023, Premier Ford announced his plan to open new private for-profit day hospitals in 3 Ontario cities. And I want to have you understand, when people hear private hospital, I think most people assume that that hospital is being paid for with private money, corporations. That's not true. It's our taxes that are paying for the construction of those private hospitals. There are different funding agreements. And yes, the government contributes a great deal of money, and the private sector does as well. And most of all, communities fundraise to build those hospitals because they know the value of them to their communities. So it is not private money building those 3 new private hospitals. What is happening is the hospitals are being built in large part with our money through fundraising or through our taxes, and then they're going to be handed over to the private sector to operate and to reap profits from those hospitals. In fact, the planning to privatize goes back further than the pandemic, or further than 2023. In July 2021, they increased funding to private clinics by $24 million. And they announced new licenses for independent health facilities. That's what I call doublespeak, just one of the many examples. Independent health facility. That's a for-profit private clinic. But they don't call it that. At least they didn't in the beginning in 21 when they announced that they were building these independent health clinics. 98% of those clinics are for-profit. Another example of doublespeak is right here in Durham. When they call your hospital a hospital, for most of us, a blue H sign for decades has meant inpatient beds, 24/7 hospital services, full diagnostic services, and more. When they removed the beds from Durham Hospital and left an urgent emergent care clinic, they've basically changed the definition of what a hospital is. And to most people in the public, when they drive by, and see a blue H, they're expecting 24/7 service. And if somebody is driving by here with an emergency and is not familiar with the area or the story of Durham's hospital, they could well arrive at that hospital expecting all of the things I mentioned, only to find the hospital closed. And certainly if they needed an inpatient bed, then they'd have to be transferred by ambulance elsewhere. So we need to look at what in fact is a hospital and not let this government get away with changing that definition. At least be upfront and not try and dupe the public. In 2023, after the election, they awarded thousands of surgeries to private clinics. Yesterday in Chesley, there was a gentleman speaking who needs cataract surgeries. He told us that when he went to the Owen Sound Hospital, one of the doctors confided in him. He's been waiting since 2022. One of the surgeons confided to him that he would love to do more surgeries, but he's only funded to operate 2 days a week in Owen Sound. So there's lack of funding. Recently, you may have heard about the change of cancer care access and treatment at Owen Sound Hospital. Those who are already diagnosed with a variety of cancers that have normally been treated there will continue to be treated. However, people who are newly diagnosed with certain cancers other than breast cancer, lung cancer, and colorectal, any other cancer patient is going to have to be referred and sent to either Barrie, Kitchener, or London. Now, why is that? They claim it's because they don't have the oncologists. There's only 2 oncologists at Owen Sound. Why don't they have those oncologists? I don't know for sure the answer, but I can bet that part of it is lack of funding to staff appropriately and attract oncologists to the Owen Sound Hospital. So funding is at the core of everything. In 2024, the ministry opened applications to issue more licenses for MRIs and CT scans. And once again, corporations can apply to do that. And by the way, the owners of those corporations and private for-profit clinics don't have to be doctors. In fact, there was a scandal in Ottawa a couple of years ago that came to light with 2 new private clinics that opened. And the people owning and operating them were formerly bankrupted car dealerships. Also, one of them had been convicted of sexual harassment. So anybody who has the funds or the inclination or the desire to make money is going to try and get one of these licenses and open a for-profit clinic. That scares me. You may have noticed that on Facebook recently, in the last 6 months, I've noticed a big increase in ads for private for-profit clinics. The most recent one was for an MRI and CAT scan clinic. For 100 years, Ontario has built hospitals and communities have built hospitals with their fundraising. And private for-profit hospitals have been banned for 50 years. No one has any mandate whatsoever to privatize our public hospital services. Ford constantly says that he is giving historical investments and funding. Historical. That again is another deception, folks. Historical, yes, those totals may be more than funding in the past, but they are not taking into account things like CPI or inflation. The CEO of Bright Shores, which is the Meaford, I'm from Meaford, Meaford, Wyerton, I'm going to miss them. There's 6 hospitals under that umbrella. Southampton, Markdale is one of them. Those 6 hospitals, the funding they were given for this year, the increase was 3.1. She thanked the government very much, 3.1% increase. However, she said, that won't cover the inflation or the CPI that we have to pay. And when Ford put in Bill 124, which was the wage restraint legislation that led to so many people being nurses in particular, but other hospital staff leaving the public system, and then went to court to fight that with our money and lost. He owed a lot of retroactive wages to all of those nurses. He has not yet fully reimbursed hospitals to pay those wages. So as the CEO in Owen Sound said, we still have to pay those wages from the money we've been given. And we don't know when or if we are going to get those retroactive funds to pay, or whether we're just going to be expected to pay from our budgeting, from our funds. So when Ford talks about historical investments, they're not historical, they're actually real cuts to our hospitals. And the fact is that the majority of hospitals in Ontario are in deficit, debt, for the reasons I just mentioned, and they have underused operating rooms that are not funded. Just after the pandemic, Dr. Warner from Scarborough made a video, which is probably still available on YouTube. And in that video, he said, if the government would fund the permanently closed and temporarily closed ORs in the hospitals in this province, we are certain that we could clear the cataract surgery backlog in 6 weeks. We don't need private clinics to do that. We can do it. Ford's not doing that. He wants to privatize our system, and he's forcing it upon us. The Ford government has made a political choice. It's not a necessity. It's clearly a choice, and it risks patients' care and lives. Finally, I'll just talk a bit, because Kevin's covered many of the extra costs and overbilling, so I'm not going to go over that again. But the Canada Health Act is like a patient's Bill of Rights. It says that no patient can be charged for medically needed hospital and physician care. Health care is to be provided based on need, no matter where you live, no matter how rich or poor you are. And that's what we won when we got public Medicare. Rural health care is under attack, in my opinion. Our needs are different, and we have to be recognized as a different population from say, a big city in Toronto. I have friends in Toronto. I'm from Toronto originally. You know, if you can't get into one hospital, they say to me, I just go down a half hour away to another hospital. We have to have a rural healthcare Bill of Rights, in my opinion, that meet our needs. We just can't sit by and let all of these negative changes happen to us. We have to fight. We have to, you know, the thing about deception is that you usually realize after the fact that you've been deceived and that the wool's been pulled over your eyes. But by then, it's often too late. And we are at that crisis point regarding healthcare. We need to educate our friends, our neighbors, our families, anybody we know. We need to get educated about the truth of the problems in our healthcare and the lies and deception that are currently happening, because our public healthcare system is slipping out of our grasp. And if we don't act now and in the upcoming election, I'm afraid that we're going to have lost it irrevocably, that we won't get it back. So I would urge you to continue your activism, continue your support, take action, stand up, and let's fight to maintain a healthy public health care system. Thank you. And I'd like to introduce Kevin Eccles, the Mayor of Durham, who will talk about more local issues and what's going on in Durham.
Well, I'm just going to correct you slightly there. It's the Mayor of West Grey, which
sorry.
Durham is a proud part of. Yes, that's very good. I think Kevin and Nora have explained on a more provincial basis what is happening with healthcare, rural healthcare here in Ontario. And we're part of that. And maybe one of the leading points here in rural Ontario is what's happened in Durham. The Trojan horse is very symbolic of that. The problem is, as Nora said, we've been deceived, and the horse has been amongst us, and certainly amongst the Durham Hospital, for quite some time. And we didn't recognize it. And that's, I guess, shame on us. But not all of the attacks have come out yet. That's what I warn you. And some of the attacks that have happened on the Durham Hospital, we're trying to reverse. And I think we're still in a position to do that. Quick update. The November the 13th, as you'll know, the municipality of Durham, or now you've got me doing it, Nora. The municipality of West Grey, on behalf of the Durham Hospital, launched a legal battle. On November the 13th, the South Bruce Grey Health Centre, the Ministry of Health, yeah, that's Sylvia Jones, she wasn't out to pasture that day, and the Attorney General appealed our case and said that it shouldn't be heard, that they had every right to do what they were asking to do or intending on doing. Our lawyers said it went very well, the appeal. We should be able to win that, and the case would go forward. What their point was, they didn't want the case to even come forward. The point that is being in that's already admitting guilt. If I thought I was doing what was right, and somebody was going to take me to court and challenge me, and I knew that it was right, then that was fine. I would go to court, defend myself, and say, you see, even the court agrees with me. But Mr. Ford's government, the Attorney General, Sylvia Jones, the Minister of Health, and our health board that's looking after the hospital doesn't want to go to court because they know they are wrong, and they're going to play everything we can. I'm here to say that Council is fully behind this and will not be deferred from our time in court. We're going to go. It's one of the ways that as a council we can win this, and we will. We've got to put a lot more pressure, though, on Ms. Shaw and the board, Dean Dunn as the chair, to keep the Durham Hospital open and functioning. The transparency, or very much the lack of transparency that they have shown is very frustrating. But we will keep the pressure on, and we're going to keep this hospital open. I'm not going to talk any longer because I certainly could, because if we stay out here any longer, everybody's going to have frostbite, and the emergency room probably isn't open today for us. So thank you very much. Thank you for coming out and continue to fight for us. Nora.
Can I call? We'd like to get a picture with everybody. If you are willing to come and stand in front of the horse with your signs. Some people will take pictures. You may see it posted. If you're willing, it would probably be posted on our Grey Bruce Health Coalition website. We would send it also to the Ontario Health Coalition. So I hope you're willing to have that, be participating in that. And thank you very, very much for coming today. Please spread the word.
Well, you can always find more information on the Ontario Health Coalition Network's website. It's on your screen right now. And if you want more information, visit that and support your local hospitals. I encourage you to do that. We need our hospitals to keep us healthy and safe and open 24 hours a day. I'm Adam Olivero. Thank you so much for watching.